Hey, so in previous slides, I discussed the external structure and the cartilages, ligaments, and membranes of the larynx. In this lecture, I'll discuss the interior of the larynx or the laryngeal cavity. So, what is the extent of the larynx? As I've told you previously, that it extends between the epiglottis above till the cricoid cartilage below. And this part lies against the vertebra C3 till the C6 vertebra. The boundaries of laryngeal inlet are very important. This is the inlet of the larynx. Anteriorly, it is bounded by the epiglottis. Posteriorly, it has the arytenoids along with the corniculate cartilages on top of the apex of the arytenoids. And on each side, we have aryepiglottic folds. So this opening is the laryngeal inlet. Anteriorly, the epiglottis. Posteriorly, the arytenoids as well as the corniculates. And laterally, the aryepiglottic folds on either sides. Now, the cavity of the larynx is such that it has three parts. One is the laryngeal vestibule, one is the middle part of the laryngeal cavity, and third is the infraglottic cavity. So, the part of the larynx between the epiglottis above till the vestibular fold below is called the laryngeal vestibule. Next part is between the vestibular fold here till the vocal fold here, and this slit-like space is the middle part of the laryngeal cavity. And the last part of the larynx is the infraglottic cavity that is below the vocal folds. Laryngeal muscles are very important. We have extrinsic laryngeal muscles and intrinsic laryngeal muscles. The extrinsic laryngeal muscles are the infrahyoid muscles below the hyoid bone and they depress the hyoid and the larynx. And the suprahyoid muscles are above the hyoid bone and they elevate the hyoid as well as the larynx. Here we'll only discuss the intrinsic laryngeal muscles and they have very great significance. These are the intrinsic muscles of the larynx. They are cricothyroid, posterior cricoarytenoid, lateral cricoarytenoid, transverse arytenoid, oblique arytenoid, thyroarytenoid, and vocalis. Now we'll discuss these one by one. Cricothyroid, as the name indicates, is between the cricoid cartilage and the thyroid cartilage. This brown muscle is the cricothyroid muscle. Next is the thyroarytenoid muscle. As the name indicates, it lies between the thyroid cartilage till the arytenoid cartilage. This green part is the thyroarytenoid muscle. Here we can also see the thyroarytenoid, this between the thyroid and the arytenoids. Next is the posterior cricoarytenoid. This is attached between the cricoid cartilage and the arytenoids, muscular process of the arytenoids. The lateral cricoarytenoid, just like the posterior cricoarytenoid, is between the arytenoid, the muscular process of arytenoid, and the cricoid cartilage. Transverse and oblique arytenoids are attached in between the two arytenoid cartilages. The transverse fibers are transversely placed, and oblique arytenoids are obliquely placed between the two arytenoids. This is the aryepiglottic muscle just beneath the aryepiglottic fold. As I've told you in the first slide that the lateral boundaries of the laryngeal inlet are formed by the aryepiglottic folds here. So this is the area of the aryepiglottic muscle. Vocalis muscle is this green structure is the vocalis muscle. It is lateral to the vocal ligaments and medial to the thyroarytenoid muscle. This slide is the most important of this entire lecture. The various muscles which are acting on the larynx, and you have to learn it by heart. Elevation of the larynx is caused by the suprahyoid muscles, which are the thyroid and the mylohyoid. Depression of the larynx is caused by the infrahyoid muscles, which are the sternothyroid and the sternohyoid. Opening of the larynx is by the thyroepiglottic muscle. Closing of the laryngeal inlet is by the aryepiglottic muscle. Abductor of the vocal cords is by posterior cricoarytenoids. Adductors are lateral cricoarytenoids, transverse arytenoids, and the oblique arytenoids. Tensors of the vocal cords are cricothyroid, and relaxers are the thyroarytenoid and the vocalis. Now, as you can see in this picture, this pink area is the rema glottis, and the lateral extent of rema glottis is by the vocal ligament. Position of the vocal ligament determines the various sounds that are produced, or either we are in whispering or talking loudly, or in normal respiration or in forced respiration. The position of rema glottis is different. So, in normal respiration, when the laryngeal muscles are relaxed, rema glottis is slit-like. It is narrow and slit-like. During forced respiration, the vocal ligaments are abducted by the action of the abductor, which is posterior cricoarytenoid, and the shape of glottis is inverted kite-shaped. During phonation or speaking, the glottis, rema glottis is slit-like again, and the vocal ligaments are adducted by the lateral cricoarytenoids and the arytenoid muscles. During whispering, they are strongly adducted by the lateral cricoarytenoids, and the rema glottis is completely shut down. Now we'll briefly discuss the blood supply of larynx. It is very simple. Above the level of the vocal cords, the blood supply is by the superior laryngeal vessel, which is a branch of the superior laryngeal artery. And below the level of vocal cords, it is supplied by the inferior laryngeal artery, which is a branch of inferior thyroid artery. Above the vocal cords, the venous blood is drained into the internal jugular vein, and below the level of the vocal cords, the blood is drained into the left brachiocephalic vein. Nerve supply is also important. Above the level of vocal cords, nerve supply is by the internal laryngeal nerve, and below the level of vocal cords, the nerve supply is by the recurrent laryngeal nerve. Lymphatic drainage above the level of the vocal cord as well as below the level of vocal cords is by the deep cervical lymph nodes, above by superior group and below by the inferior group. That's all for today. Thank you. If you have any queries, do ask in comment section.